In the depths of your joints, a quiet storm can be brewing, and you may not even know it. Imagine waking up with pain in your hands, your knees, your feet, and the feeling doesn't go away. It only gets worse. If this sounds familiar, you might be dealing with a condition known as rheumatoid arthritis, a chronic disease that targets your joints, causing inflammation, pain, and even irreversible damage. But why does this happen? And more importantly, what can we do about it? Today, we'll explore the science behind rheumatoid arthritis, backed by groundbreaking research, to uncover the causes, symptoms, and most importantly, treatments that can help manage this condition. And remember, this channel, The Research Paper, is all about empowering minds with research backed wisdom. In a study conducted by the University of California, San Francisco, researchers sought to understand the genetic and environmental factors that trigger rheumatoid arthritis. Published in 2019, this research analyzed over 7,000 participants to pinpoint specific genes linked to the condition. Their findings revealed that certain variations in the HLA-DRB1 gene could significantly increase the risk of developing rheumatoid arthritis. But what does this mean for you? It tells us that while genetics play a role, they're not the whole story. Environmental factors like smoking and even diet can act as triggers. Practical application? If you're genetically predisposed but haven't developed rheumatoid arthritis yet, it's crucial to adopt preventive measures. Avoid smoking, which is a known trigger, and focus on an anti-inflammatory diet. Think of incorporating omega-3 rich foods like fatty fish and antioxidants from fruits and vegetables, which can help reduce inflammation and protect your joints over time. But that's not the only piece of the puzzle. A study from the Mayo Clinic in 2017 shed more light on the psychological aspect of rheumatoid arthritis. Researchers found that stress could exacerbate the symptoms of rheumatoid arthritis, leading to flare-ups. They analyzed data from 5,000 patients, focusing on how mental health influences the severity of symptoms. The study revealed a strong link between high stress levels and more frequent flare-ups, as well as a worsening of joint pain. Now, you might be wondering, how does stress impact my arthritis? Well, the answer lies in our body's stress response. When you're stressed, your body releases chemicals like cortisol and adrenaline, which can trigger inflammation. So, in the case of rheumatoid arthritis, stress doesn't just make you feel anxious, it makes your body's immune system attack your own joints. Here's the takeaway for you: manage your stress levels. Try mindfulness techniques like meditation, deep breathing, or yoga. Regular practice of these can lower stress, reducing inflammation, and preventing those painful flare ups. Think of it as not just calming your mind, but also protecting your joints. And lastly, let's talk about the treatment side of things. A landmark study published in The Lancet in 2021 examined the effectiveness of early treatment with biologic drugs in patients with newly diagnosed rheumatoid arthritis. The study, which followed 1,500 participants over a 2-year period, found that those who began treatment with biologics early in their diagnosis experienced fewer long-term joint damage and better overall outcomes compared to those who started treatment later. What does this mean for you? The earlier you begin treatment, the better your chances of preventing long-term joint damage. If you suspect you have rheumatoid arthritis, don't wait. Consult with your doctor about biologics or other disease-modifying drugs that can slow or even stop the progression of the disease. Through these studies, we've learned a lot about rheumatoid arthritis, and we've seen that while the science is complex, there's a lot you can do to improve your quality of life. From managing your stress to adopting an anti-inflammatory diet and seeking early treatment, the power is in your hands. So remember, we're here to empower minds with research-backed wisdom. And now it's up to you to use that wisdom to live a healthier, more comfortable life.